Hi, welcome to Main Street Macro. I'm Neela Richardson. Last week, we gave you a preview of the Jackson Hole meetings by the Federal Reserve. Remember, this was a convocation of central bankers, academics, and business leaders to talk about key global issues. And the theme for this year is structural shifts in the global economy. So when I was asked to give remarks at this year's meeting, I really wanted to reflect at a key component of labor markets that's not often discussed, and that's the care economy. You can think of the care economy as the workforce behind the workforce. It really enables households, working families to do their best jobs by educating them, caring for their children, caring for their elders and parents. It's a part of the social infrastructure. And there are three main reasons why you should care about the care economy. The first is that the care economy was upended by the pandemic. You see, it requires this economy, the care economy requires person to person contact. And at a time where we were social distancing, that social infrastructure really was affected and impacted in a corrosive way. People weren't able to take their kids to school. There wasn't always the ability to get the care, either mental or physical, that members of their family needed. And that impacted the ability of many workers, especially women, to return to their jobs. And simply, many women actually had to leave the workforce to make up for the care that was generally provided by institutions. Thankfully, the pandemic has receded a lot since those days, but this impact on the social infrastructure remains. The second reason why you should care about the care economy is because the demographics are only going to make this economy more important over the next decade. You see, where we're seeing the most population growth is not with prime age workers, those people who are around 25 to 55, but the fastest growing populations are the youngest, 0 to 14, and the over 65. So now more than ever, we are going to need professionals to really help care for our kids, care for our elders, and care for us as workers in order to stay healthy and thriving and productive in the workforce. The third reason why you should care about the care economy is related to those demographics, because the demand for workers, whether they're teaching or nursing or any part of that social infrastructure occupationally, that demand is soaring, and yet the supply is not keeping up. When we look at ADP data, we see that we've seen tremendous improvement in nurses, for example, but still not enough growth to keep up with demand. For teaching, it's even a little more dire because teaching hasn't returned to pre-pandemic levels in terms of occupations and people joining that occupation, and yet demand is still soaring. So all in all, that care economy and its future really will affect economic growth, and it's worth Main Street's attention and investment. Thanks for watching the Main Street Macro. For more information on those very important discussions at Jackson Hole, please check out adpri.org.